Hey guys, Dr. Greg Stowe down here in Dallas, Texas, doctor of chiropractic, and I want to talk to you about pelvic anatomy and go through my x-ray and just tell you about what I've been dealing with for several months now, about 21 with pelvic pain and how that's affected my body. And we're just going to talk about my x-ray so you can understand and maybe this can help you. So let me know what you think. So first I want to start off and show you what a normal pelvis looks like. And here we have a sacrum, and at the bottom of it is what we call the coccyx, or this is called the tailbone. These two bones down here are usually, we call these the sit bones. And in the middle of this we have something called the pubis symphysis. Now inside here is called the pelvic bowl, and understand these aren't necessarily that close. This doesn't really capture a 3D model, so understand this is towards the back, this is towards the front. This is right above the genitalia, and this is at your backside, in between and at the bottom of your gluteal folds. Here we have the pelvis on each side, what people sometimes refer to their hips. And here is the opening for the femoral head, or the ball and socket joint. So that's generally what it looks like. And I want you to know I want you to notice the relative alignment of this pubis symphysis, just going kind of in the same alignment as that sacrum and coccyx go up. It's pretty straight. We'll show you another one here. Again, this is also showing the same features a little bit differently. They've covered the acetabulum's blue, and they've also highlighted the color of the symphysis pubis a little bit better. Here's another one. You can see pubis symphysis there. Again, it's that joint which lies between the pubic bones. And joints are things that absorb pressure, absorb and distribute stresses. This joint is doing just that. It's absorbing those stresses. What I want you to realize, though, is this joint can have effects on some people, and I want you to understand and learn from this really how it relates to the closeness to the location of the bladder. So male pelvic anatomy, and there, right there, pubis symphysis, and then the bladder right behind it. This is a sagittal view, bisected in the middle. So not a perfect representation with the vas deferens, but it's there. We'll look at some female anatomy. Here we go, pubis symphysis right there, bladder right behind it, urethra coming down right there. So pubis symphysis right there. Here's another picture again, yeah, just circled. Again, just finding these off Google. Just Google pubis symphysis bladder. Just find things that were both related to those. Pubis symphysis right here, bladder right behind it. Not much space. So you could imagine if this joint were to get inflamed, how that could potentially affect the bladder. Again, better picture. Pubis symphysis, bladder. Not much space in between there. Okay. So I'm going to show you now generalized X-rays on Google. And you can just Google pelvis AP X-ray and look at all the different ones. Here you see that opening. The pubis symphysis is not a bone, so it doesn't show up on the X-ray. It shows up as an empty space. So you know it's in that relative space because you can see through it. And do understand there's that almost that perfect line. You know, not completely perfect, but you see it's a relatively straight line between that pubis symphysis and that sacrum going up, coccyx and sacrum. Here, and again, this one's maybe slightly off, but again, pretty well-defined straightness, centering of that. We don't want to get into the pathology ones, but here, that one's even more off. You see it, but I would say still relatively close. But there's all different kinds here. Again, you can just look through. Again, sacrum, pelvis, coccyx, and all sorts of examples. My point is just showing you how relatively they're all straight, with that sacrum coming straight down right in front of that pubis symphysis. I suppose that's enough examples. So then I want to move on and show you my X-ray. These are lines I already drew. I'm going to take them off just to redraw them and show you what's going on. Again, I've been dealing with pelvic pain now for about 21 months, and I'm finally coming back to my roots in my profession because I just kind of ignored it. I was doing all sorts of other stuff to see what could get it better, and I finally came back to this. That's the relative line of my sacrum and coccyx, and then here is just about the relative line of my pubis symphysis. I'll try to get that going straight through. You can see they're heading in different directions. They're not parallel at all. They're off pretty good. That's a several millimeter gap, maybe half a centimeter. Also, I'm going to draw a few other straight lines right here so you can see them. There's the height difference in my right to left side. If it matters, this is actually right, this is left. Almost like you're looking at a picture of me. Understand, right is on the reading left. So, same thing in the femoral heads down here. So things on the left have changed. They've gone up higher, potentially more forward, and the right side's gone back and down. So this is more circular, this is more oval. You can tell they look different. This one has gone backward slightly and lower. This one's come forward and slightly higher. And now we have this shifting in the pelvic heights relative to each other, and we have what's now a huge differentiation in the angles of where the pubis symphysis is heading and the relative angle where the coccyx is heading. So this should be straight. We really should have a straight line that comes down from the center of any lumbar spine, coming straight down like so. And you can see this starts heading way off here, and now this is heading in the opposite direction. So we're getting a lot of inflammation here. We're getting a lot of pulling in the pelvic floor, but the pubis symphysis, I would theorize, is under a lot of stress. And with stress comes inflammation in that joint. And what sits right behind that joint is the bladder. So not only that, but you have all these pelvic muscles, again, that are around the pelvic bowl, and some are getting pulled in one direction, the other side's getting pulled in the other direction. This right side is potentially, you could say it's going counterclockwise, and the left side's going the other direction. So they're turning opposite of each other and putting a lot of stress on that pelvic floor. And you can see those pictures if you like of the pelvic floor. We'll just Google some. So there's one right there, and as I showed you before, no, this is a bottom up view. This is the coccyx, this is the pubis symphysis, and you can see they're in a straight line. Well, my coccyx is now angling off in this direction, and now my pubis symphysis is angling off in this direction. So that's going to put a lot of stress on that tissue. And biomechanically, now that the whole pelvis is rotated, there's a lot of stress on that pubis symphysis. So I wanted to share that with everybody so they could get a different understanding. I know not everybody has the same issues, but some people may have an issue with this. The only way to really know it is to get an x-ray and understand what's going on. If you adhere to pelvic floor issues and you understand that issue and you found some relief with that, or if you believe that there's postural imbalances, it's really, you're not going to get the same value out of those things unless you have an A to P view of your pelvis to see these angulations. If you're going to treat tissue, you got to know where the tissue's at, how it's moved relative to the bones, because tissue is attached into bones. That tissue is woven into the insertion point. It goes from a muscle to a tendon to actually a connection into the bone, and it's woven into that bone. So if those bones and those joints are twisted and they're pulling out of alignment like mine is, that's going to produce potentially a lot of problems in the pelvis. So especially people who feel flare-up after exercise or a flare-up with walking. You could imagine walking The pelvis is, the SI joints here and here are moving relative to each other back and forth, and then there's going to be some movement here. And if this is already extremely rotated out, it's going to be an issue. One other thing I'll highlight is these openings here. You can see that one there, how big it is, and you can see, I'm going to bisect that because it's a little bit of a rotation there. It's catching some of it, but that's the relative size of it there. And to be fair, I'll try to stay in the line, but you can definitely see this one is much larger than this one. Okay. And you could say there, but I think there's some rotation there, so I want to give some of that to count. But there's a big difference. So one of these is turned forward, one of them is turned backwards. A lot of pressure on this area right here. A lot of pressure on the joint called the pubis symphysis. That could potentially lead to inflammation in that joint, which could definitely spread right into the bladder muscles, irritate that, and cause a lot of bladder disruption. Well, I hope this video has helped you. Don't take this video as a diagnostic of your issue or as medical advice necessarily. Use this information to help seek out qualified providers to help you. If you're seeing somebody and you're getting results, maybe you've plateaued, this may be your next option to check out. So please consider that so you can continue on this journey to find out what's going on. Definitely a better option to consider before you opt for a surgery, or if you've already done a surgery, you're trying to prevent another one. Get more options. If you're just doing pelvic floor therapy but you don't have an x-ray, it's probably time to get one if you're still continuing with the problem. The more things that you know, the more you can help yourself. I'm down in the Dallas-Fort Worth area of Texas. You're more than welcome to go to my website at www.paininthepelvis or on our Facebook page at Pain in the Pelvis. Send me a message, reach out to me. I would love to help you. And especially if you have an x-ray already, take a picture of it, and we can find a time to look at it and go over it together. Thank you. Best of luck to everybody.